welcome to Health Talk here on AETV Live. My name is Ogaga Ikama, and I'm your host. Health Talk is your number one health educating program where I get to interact with different health professionals on matters relating to you and your health. Today, I've got Dr. Adeze Eze from the Public Health Department of the Federal Medical Center, Asaba, Delta State, and she's here to have a talk with me on tuberculosis. Hello, Doc.
Hello.
Welcome.
Thank you.
It's good to have you.
Thank you.
Okay, but before we get into the topic proper, to benefit from this talk and subsequent health talks, please do well to subscribe to this channel, turn on notifications, and like and share this video. Thank you. So, according to the World Health Organization, WHO, every year, 10 million people fall ill with tuberculosis, which is popularly known as TB. And 1.5 million people die from TB each year, making it the world's top infectious killer. So TB is the world's top infectious killer. Before you told me about this topic, I didn't even know that it was the world's top infectious killer. And this even made it more interesting and shows that it's a topic that every individual should be knowledgeable about to know how to prevent oneself and go about treatment and all of that. So let's jump right into it. Let's get to know more about this world's top infectious killer. What is tuberculosis?
Okay, so tuberculosis, or TB, as we commonly call it, is a chronic disease that affects the lungs, but then it can affect other organs. However, 80% of cases we have affect the lungs. So it's caused by a bacteria called the Mycobacterium tuberculosis. And like you said earlier, it's one of the top infectious diseases that we have out there, which can kill people. But then the good thing about this disease is it has a cure.
Okay. So now, first of all, it's a bacterial infection.
Yes.
It affects different organs of the body, but majorly the lungs.
Yes.
So now, while studying just reading up about tuberculosis, I found out that I saw the TB infection and the TB disease. What is the difference?
Okay, so usually TB can be classified into the latent TB or the latent TB infection or the active TB disease. So when someone has the latent TB, that's the TB infection, it means that the person is infected with the bacteria. However, the body has been able to contain that disease. So the microorganism has gotten into the system and has tried to attack the system, but then the immune system is strong enough to kind of wall off this disease. So it is containing the infection. In this kind of case, the person is not presenting with symptoms. And most times, they don't spread the disease. In fact, they can't even spread the disease. It's just walled in by the fighters. That's the immunity. It's kind of has contained the infection, so they can't manifest symptoms and they can't spread the disease. But then maybe we'll get to that later, but then there are conditions that can actually activate this latent TB infections.
Okay.
Then on the other side, we have the active TB disease. So this is where someone is infected with this bacteria and then it's making them sick. So they are manifesting symptoms and they can actively transmit this disease to the next person. So that's the difference.
Okay, so if I get you, basically the TB infection most times is in the latent state. Yes. And it's not communicable.
It's not communicable.
Transmissible. Okay. So apparently I was going to ask that question, but apparently you've answered that. So TB is a communicable disease. It can be transferred. So before we look at the risk factors, can we talk about how this disease or this bacteria, should I say, I don't know whether to say the bacterial infection can be transmitted, since you said the infection most times is in the latent state, but how can the disease be transmitted from one person to another?
Okay. Basically, TB is an airborne disease. So to simplify it, it's carried by air. So it can be transmitted by respiratory droplets. So when someone that has the disease coughs, sneezes, laughs, or just performs any activity that can render bacteria in the maybe respiratory tract homeless, that's kind of releases it into the atmosphere. That means the person next to the person can get it. So it's transmitted it's carried in the air, and then the next person can inhale the bacteria and then get it.
Wow.
So
it's a little bit scary, so to say. But I think as we progress, maybe when we get to prevention, I'll revisit this means of transmission. Okay, so now let's talk about the risk factors.
Okay.
The causes of TB.
Okay. Well, the major cause of TB, or the cause, is the bacteria, the Mycobacterium tuberculosis.
Okay.
So now the risk factors, that's the factors that make someone susceptible to getting this disease, are, for one, is something we call immunosuppression. So when someone's immunity is below the normal, it makes them vulnerable to getting this disease. So people with diseases like HIV and AIDS, which is known to reduce the immunity, people with tuberculosis, people with some cancers, and those on treatment for cancers, because some of the management modality for cancers reduces the immunity as well. All these people are at risk of developing this disease. Then people in the extremes of ages, that's children, that's very young children, babies, as well as elderly people, their immunity is not optimal as well. So they are at risk of developing this disease. Then we also have healthcare workers. They are also at risk of developing this disease. And this is because some of them deal with people that already have this TB. Like I said, it's airborne. So working with them, working with patients that have TB in the ward, in the clinics, predisposes them to TB. Then family members of people that have TB are also at risk of developing this disease. Then people that are malnourished as well are at risk of developing it. So poverty, malnutrition, overcrowding, improper ventilation is also, they are all risk factors for this disease. So there are lots of risk factors. I don't know if I've exhausted them, but then these are the major risk factors.
Okay, interesting. So majorly, most of the risk factors you mentioned, they are kind of related to the immune system. So when you talked about the immunosuppression. When you talk about children, you can tell that at a very tender age, their immune system is not well developed yet.
Yes.
And the aged, their immune system is becoming weaker.
Yes.
Okay, then you also talked about cancers, how those cancer patients, the therapy they go through tends to weaken their
immune system.
Immune system, yes. So let's talk about the symptoms. How can one tell that this person is down with TB? So the first question is, can you detect with a sign or a symptom the infection when it is in its latent stage, like you mentioned? So let's start from the latent. Let's know the signs and symptoms that shows up, that one goes down with, and you can tell, okay, this person has a TB infection. And the signs and symptoms as well, you can see and say, okay, this person has the TB disease.
Okay, so the latent TB infection doesn't manifest with symptoms.
Okay.
So most people with latent TB, they find it out accidentally. For instance, someone might walk into the clinic because they want to travel outside the country, or they just got a new job, and then they need to get a certificate of medical fitness. So one of the tests that they have to go through is this TB test. So maybe through that, you can find out that they have TB. But then these people are perfectly healthy. They do not manifest any symptoms. And without the testing, they might actually live the rest of their lives without knowing they have TB, unless maybe something happens and brings down their immunity. So in the active TB disease, there are symptoms, they are showing symptoms. And the commonest symptoms we see. Okay, maybe before I go into the symptoms, I think it's important to classify TB again into the pulmonary and extrapulmonary. So pulmonary is the one that affects the lungs, and then extrapulmonary affects other organs. I brought it in because different systems present different ways. So the pulmonary TB, most people with pulmonary TB are going to come down with cough. So if anyone has cough that has lasted for more than 2 weeks, it's important they get tested for TB. So other symptoms can be fever, fever that is not responding to malaria treatment, because in our environment, most people tend to start treating malaria immediately they have fever. So once someone has taken malaria medications and the fever is not responding to it, it's important that they get tested for TB. So cough that has lasted more than 2 weeks, fever that is not responding to malaria medications, then night sweating. So this one is important as well. Imagine being in a house and then everybody's putting on cardigan, and then this person is sweating more than he should. Or maybe the person wakes up early in the morning and finds out that their bedsheet is drenched with sweat. That's another symptom of TB. Then another symptom is weight loss. A lot of TB patients end up losing a whole lot of weight. So they lose a whole lot of weight, which can be evidenced by maybe their clothes not fitting anymore, or maybe people will be telling them that they are not putting on weight or they are losing weight. So we have other symptoms like shortness of breath. We have some people cough out blood. However, it's not advisable to wait till you start coughing out blood before you start looking for help. So we also have shortness of breath. We have a general feeling of unwell, and then that's for pulmonary. Then for the extrapulmonary, depending on which organ it affects, if it affects the bone, the person can come down with pain on that particular area on that area. If it's the hand, or depending on where the bone is located, the person can come down with pain at that area as well as swelling. Some people have TB of the spine, so that area of the spine is usually swollen as well, and then very painful. Another thing is people that have TB of the spine can even present with an inability to walk. Maybe they just wake up one day and find out that it doesn't happen in one day anyway, but then they can just wake up and find out that they're unable to walk anymore. Then there are people that the TB affects their brain, or the covering, the meninges that cover the brain. So these people can come down with headache. They keep having headache, constant headaches. Some of them can come down with convulsions. Some of them can even present unconscious. So we also have TB that affects the abdomen. So in this case, the abdomen can get swollen. They have abdominal swelling. They can have some, like when they touch their stomach, they find out that there are masses, like they can feel some hard swellings in their stomach. Then it can also affect the urinary tract, maybe the kidneys or just the urogenital tract. And then in this case, the person can have blood in urine. So it depends on where the TB is affected. Where it affects determines the symptom the person presents with. But then in most cases, it affects the lungs, and that's where the cough comes in.
All right, this is still Health Talk here on AETV Live, and I am with Dr. Adeze Eze from the Federal Medical Center, Asaba, and the conversation has been on tuberculosis. She has taken us through what TB is, the difference between the TB infection and TB disease, how it is transmitted, the risk factors. She just finished telling us about the signs and symptoms. We'll be back shortly.